Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. Our guest is Dr. Suela Sulo. She's Abbott's lead nutrition study investigator, and she's joining us here on the program today to talk about nutrition protocols and how those nutrition protocols need to change as they relate to patients undergoing surgery. Welcome to the program, Dr. Sulo.
Thank you very much, Neil. Thank you for the opportunity.
Well, as I said, you are lead investigator with Abbott. Just a bit of background about yourself, if you would.
Yes, I'm a health outcomes researcher at Abbott, and I study the total value of nutrition, so the impact that it has on patients' health, as well as economic outcomes for the patients themselves, but also for healthcare systems in general.
Now, obviously, nutrition is extremely important, but how are these protocols that we're going to talk about affect people who are undergoing surgery directly?
Yeah, so when we look at malnutrition, it is invisible to the eye. It can occur in patients that, or in individuals that are overweight, underweight, and in fact, across the United States, 1 in 3 patients that enter the hospital are malnourished or at risk for malnutrition. When we think about surgeries, surgeries in general can take a toll on patient's body, and therefore proper nutrition care is necessary in making sure that patients can recover faster and they can experience better health and better hospital outcomes. When we look at the hospitals in general, they perform over 48 million surgeries every year, and so it is important to absolutely identify patients when they enter the hospital for their malnutrition risk, whether they are surgical patients or patients that are coming to the hospital for other diagnoses, but particularly for surgery, since they are the ones that may not consume food or drink before the hours leading to the surgery and immediately after surgery.
So we're talking about malnutrition just before surgery. I think that's kind of par for the course. Or are we talking about someone who's consistently or chronically malnourished and then all of a sudden has to undergo surgery, and those are the things that we need to be looking for?
We're looking pretty much at all individuals that enter the hospital, regardless of their diagnosis or the reason why they're entering the hospital. We are highlighting in this research the importance of malnutrition screening and as well as feeding patients with the right or nutritional supplements, the ones that undergo surgery, given the fact that surgery itself can put a huge stress on someone's body and can negatively infect their immune system.
How are you determining whether someone is nutritionally fit to undergo surgery or nutritionally fit just entering the hospital for some other procedure?
Well, the good thing about malnutrition, if we can say that there is something good about it, it's the fact that you can easily screen patients for malnutrition and confirm if someone is at malnutrition risk. In fact, what we did as part of the research project with Advocate Healthcare that my company Abbott supported was with 2 questions that were implemented in the electronic health record, you were able or you were in the position to inform if someone is at risk. One of the questions has to do with whether the patient is experiencing poor appetite, and the other one has to do with unintentional weight loss.
So if it's unintentional weight loss, do you automatically look for something else that's causing the weight loss other than just being stressed, illness leading up to surgery, and something that may blow over after recovery?
That's exactly correct. So you use the screening tool in order to determine someone's risk, and there, of course, you have registered dietitians in the hospital as well as physicians to ensure that the unintentional weight loss is not related to particularly to surgery itself, but it's an underlying condition, and it's primarily because the patients are not getting the right nutrients that they need. And in fact, when we look at malnutrition, what it is, it's pretty much your body not getting the right nutrients that it needs, whether it's minerals, carbohydrates, or vitamins.
Are these nutrients necessary before they undergo surgery? You say if someone is determined to be malnourished, not severely malnourished, but they could be a little bit better nutritionally fit. Do you administer these minerals and nutrients as a protocol prior to surgery and shortly after to speed up recovery?
So certainly, in addition to a healthy diet, of course, which is always important, in order to help patients prepare for and recover from surgeries, whether they are malnourished or not, but of course, most importantly for your malnourished surgical patient population, it is important to think about or nutritional supplements that can be used prior to surgery and after surgery. And in fact, just last year, Abbott launched a couple of new products to help patients prepare and recover faster. And these products include Ensure Pre-Surgery, Ensure Surgery, as well as Ensure End Life.
You know, you mentioned that it was fairly easy to determine whether or not someone was malnourished or basically nutritionally fit or unfit. Why do you think more physicians and surgeons and healthcare practitioners aren't doing these screenings as a standard operating procedure?
Well, for decades, the focus has been on making sure that patients do not consume any food or drinks in the hours leading up to surgery. So healthcare professionals are used to the mentality that you don't have to feed your patients before or after. Mm-hmm. And also, in terms of surgical nutritional guidelines, for many years they were not updated, and we are excited to communicate that nowadays the surgical nutritional guidelines have been updated and allows patients to have clear nutritional drinks prior to surgery, 2 hours prior to surgery, as well as immediately after surgery.
How is Abbott, in addition to the research that it supports, engaging in and getting the awareness out about the need for change in these protocols and maybe conducting some more research into the benefits?
Absolutely. So more important and influential research. As a worldwide leader in science-based nutrition, Abbott continues to identify partners and expert organizations like Advocate Healthcare in order to educate and train not only the healthcare professionals, the patients themselves, on both the importance of malnutrition screening, but also malnutrition treatment through oral nutritional drinks.
Now, in which publication are we able to find this data and learn more?
The new data from the Advocate Healthcare study supported by Abbott can be found in the Journal of Parenteral and Enteral Nutrition. These data were published earlier this year, and a lot more research is underway. So we'll be excited to report that a lot more research will be published in the days and years to come.
And we can go online and learn more at Abbott's website.
Yes, you can definitely go to abbott.com to find more information about this particular research and nutrition, as well as our nutritional supplements in general.
Thank you for taking the time today, Dr. Suela Sulo. It's been a pleasure, and I'm hoping you'll come back and join us sometime in the future.
Absolutely. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the show are available at hpr.fm and healthprofessionalradio.com.au.